Homelessness means different things in different contexts, and it depends on the purpose. So a lot of times when people think of homelessness, they picture street homelessness or someone living outside. But of course, also people can be homeless, but staying with somebody or a temporary shelter or having a place to stay inside. Additionally, there's a time element. If we say right now, today, like last night, where did you sleep? How do we define homelessness? That is different from saying in the last year, how many people experienced at least one night, for example, when they didn't have a place to sleep. There are two ways of thinking about this question, right? You're asking the question of, among all people living homeless, what is the proportion of people who are living with HIV? And how does that compare to the housed population? Some of that can be difficult to define, again, because we don't have a lot of data systems that track, for instance, all of the characteristics in people who are homeless. But there have been studies to estimate that. It is definitely more common, substantially more common than in the housed population. Another way of looking at the question about HIV and homelessness is among people with HIV, how many of those are people living homeless? And that seems to be somewhere in the arena of 9 to 17%. It is higher among people who are living in cities, especially high-cost cities like where I live, Seattle, Los Angeles. And I think your question about why is it more common is really because the things that lead to homelessness and predispose to homelessness are some of the same things that can put people at risk for HIV. So both of them are increasingly problems of poverty and lack of resources. When people are living homeless, they certainly are at more risk for HIV, in part because of things like concurrent drug use that leads to that, and also because of survival needs when someone is living homeless, which can be related to things like exchanging sex for drugs or money, and therefore tied to HIV. So it's really about the factors that are common to both of them, in particular, drug use, mental illness, and poverty.